Now we will be talking about the anatomical position and directional term. Whenever you see an anatomical drawing, like this one, you're looking at the standard anatomic position. Anatomical position is the description of any region or part of the body in a specific stance. In the anatomical position, the body is upright, directly facing the observer, legs parallel to one another and directed forward. The upper limbs are at the side of the body with the palm facing forward. This keeps everyone on the same page when you're talking anatomy and physiology. There are also called the prone and supine position. This stance should be very familiar to you. If the anatomical position is placed face down, it is in the prone position. If the body is placed face up, it is in the supine position. These are just only some of the example of anatomical position, but there are other positional descriptive terms that appear regularly in anatomy texts. These are the other examples of anatomical position and directional terms.
Directional terms. Directional terms describe the position of structures relative to other structures or locations in the body. Body directional terms. Cephalic, caudal, anterior, posterior, medial, lateral, distal, and proximal. The directional terms. Superior, toward the head. Inferior, away from head. Anterior, front. Posterior, back. Medial, toward the midline of the body. Lateral, away from the midline of the body. Proximal, toward or nearest the trunk, or the point of origin of a part. Example part of the superior is the hand. Example part of the inferior or caudal is the foot. Example part of the anterior or ventral is the kneecap, were located on the side of the neck. Example of posterior or dorsal is the shoulder blades at the side of the body. The medial. The example part of the medial is the middle toe that is located at the middle side of the foot. The example of lateral is the little toe located at the side of the foot.
They are also called the regions of the body. The anatomical regions compartmentalize the human body. Just like on a map, a region refers to a certain area. To explain it further, here's Miss Anne.
Hi everyone, I am assigned to discuss about body cavities and regions. First, cranial cavity. It is located within the skull. The organ involved is brain. Second, spinal cavity. It is located within the vertebral column. Organ involved is spinal cords. Third, thoracic cavity. It is located within the rib cage. Organ involved are lungs, heart, trachea, and esophagus. Fourth, abdominal cavity. The organ involved are stomach, liver, most of the intestine, pancreas, spleen, and kidneys. Fifth, pelvic cavity. Organ involved are portion of intestine, ovary, uterus, and urinary bladder. That's all. Thank you.
On the other hand, medical professionals often refer to sections of the body in terms of anatomical planes, flat surfaces. These planes are imaginary lines, vertical or horizontal. Here's Miss Akiya to give us more details.
When we describe the motion of the human body, we need to identify the space in which that motion occurs. To do this, we divide the body into 3 different sections or planes. There are 3 anatomical planes in the body. They divide the body into sections and they help us analyze the movement that we're doing. So the 3 anatomical planes are sagittal, frontal, and transverse. What they're doing is dividing the body half into specific sections and allowing us to move through specific actions. So I will be showing you the three positions of anatomical planes. The sagittal plane is a vertical plane cutting the body into left and right halves. So we need forward and backward movement parallel to this plane that occurs in the sagittal plane movement, such as flexion and extension. As you can see in this lunge movement, the body is moving from front to back, flexing and extending at the hip and knee joint, therefore occurring in the sagittal plane. The next one is the coronal or the frontal planes. Run side to side and run top to bottom. These planes divide the body into anterior and posterior halves. Any lateral or side movements towards or away from the midline will be on the frontal plane. So movements such as abduction and adduction or elevation will occur on the frontal plane. Example is the jumping jack. As you can see, arms and legs are moving parallel to that plane, moving towards and away from the midline. Lastly is the transverse plane. Run side to side and front to the back. These planes divide the body into upper and lower sections. These planes are sometimes called the horizontal planes. Movements such as rotation, pronation, and supination all occur in the transverse plane. That's all, thank you.
To summarize it all, anatomical positions are important because they gave us a frame of references for describing the body, which help to avoid confusion when using anatomical terms. So that's all. Thank you, and see you on the dorsal side.